And then maybe I thought we could just go around and have everyone introduce themselves. Marilyn, I'll start with you.
Okay, great. Hi, I'm Marilyn Miner, and I am a board member with the Virginia Breast Cancer Foundation. I'm a 7.5-year breast cancer survivor, and I represent the Virginia Breast Cancer Foundation on the National Breast Cancer Coalition's board, and this year I'm currently the board vice president. So welcome.
Great. Anne?
Hi, I'm Ann Woodward. I am new to the VBCF board, having just moved to Virginia from Georgia after 30 years in Georgia. I have metastatic breast cancer, so this particular presentation is relevant to me and to people that I know. So I was diagnosed in 2015, so I'm a 6-year thriver and happy to be here.
Great. Jessica?
Hello, my name is Jessica Ramirez. I have been volunteering with the Virginia Breast Cancer Foundation since 2016, and I am currently on the Virginia Breast Cancer Foundation board and a team leader with National Breast Cancer Coalition.
Sherry?
Hi, I'm Sherry Giorgio. I'm with Gilead Sciences. I'm the state government affairs lead for the Mid-Atlantic region, and I am here really to listen and learn. So thank you for allowing me to participate.
Welcome. Nikki?
Good morning, everyone. I've been with VBCF since 2019, and I am the Operations and Resource Coordinator. So I'm excited to sit in today and kind of represent our callers, if you will.
And I'll call on Kristen.
Yes, thanks for having me today. Kristen Stover. I was diagnosed with breast cancer in December of 2021, so going through treatment right now. Stage 2 triple negative breast cancer. And I know Jessica from high school, way back to high school, and she reached out to me with once I was diagnosed, and kind of got me all into this group here, and it's an exciting thing to be a part of, and hope to help out in any way that I can, and learn quite a few things along the way. So thanks for having me today.
That's great. Welcome. And finally, Katie.
Hi, Katie Sawyer. I'm the Executive Director of the Virginia Breast Cancer Foundation and have been with the organization a little over 10 years now. So thanks to everyone for joining us, all of our wonderful board experts, as well as community people. So thanks.
Great. Well, thank you all again for being here. I'm going to attempt to share my screen and hope that that works out well for me. Okay. So, sorry, I wanted to be able to see everyone. So yes, I will kick us off here. We've sort of done some of our welcome and introductions, and I'll just give a very quick overview of VBCF's advocacy work before we launch in to what we're here today to discuss, which is the Metastatic Breast Cancer Access to Care Act. And we'll also talk about our plans for National Breast Cancer Lobby Day with the National Breast Cancer Coalition. So just as a general, most of you may know, our mission at VBCF is to educate, advocate, and eradicate breast cancer. And so as being one of the key pillars, our advocacy work focuses on both the state and national level. And this just gives you an idea of the kinds of policies and legislation that we consider, policies for all stages of the breast cancer journey, legislation that enables Virginians to receive their screenings and treatment regardless of their insurance status or ability to pay, research initiatives, and policies that are aimed at breast cancer risk reduction. So this sort of gives us an overview of sort of when we see a bill come up, what would make us interested in supporting it as an organization. And as I mentioned, we do both state and national advocacy. And at the state level, we participate in sort of state level coalitions around healthcare issues. As a broad idea, we were part of the coalitions that were focused on expanding Medicaid in Virginia. So that's an example. And we also host most years, COVID has been a little different, but most years we host annually a state breast cancer advocacy day down at the General Assembly here in Richmond, and try to meet with all of our legislators and talk to them about our priorities. Sort of to give an example of some of the things that we've worked on in the past. VBCF was instrumental in getting, Virginia is the third state to have a breast density notification law. We also worked on having a law that would cover oral chemotherapy the same as other chemotherapy treatments. So things like that to just give an idea of some of the things we work on. We also, try to meet with legislators in the off session if there's a need, and we provide testimony and public comments on, big issues that are coming that, that could impact breast cancer patients and their family. So that just gives a general idea. And at the national level, we were one of the founding organizations of the National Breast Cancer Coalition, which is based in DC. And as Marilyn mentioned, she serves on that board as well. And one of the main things we do with NBCC is participate in their breast cancer lobby day that they have every year. They identify key priority issues that they want to advocate about around research, and we'll talk about the main bill that they're working on right now in a minute. But again, in years past, we would send a bus of advocates up to the Capitol and meet with our legislators. The last few years, we have done Zoom meetings. You'll see this picture here, and those have actually gone quite well. We've been able to get some legislators in person in addition to their staff members, which is nice. So we will talk a little bit about our plans for Advocacy Day or Lobby Day, which is May 3rd, Tuesday, May 3rd, 2022 this year. So then I think I will pass off to Marilyn Miner to sort of give an overview of the Metastatic Breast Cancer Access to Care Act, one of our key policy priorities, and Marilyn will tell us a little more about that.
Let's see, the way I'm looking at my view, I'm not sure that I can see your slide.
Oh.
I see it now. I see it now. Just making some adjustments. Okay, so first I will share with you a little bit about who the National Breast Cancer Coalition is. It's an organization made up of grassroots organizations and grassroots advocates like us at the Virginia Breast Cancer Foundation, from representatives throughout the country and I believe Puerto Rico. And in addition to the advocates, it also includes researchers, research organizations, scientists who also participate in some of the legislative priorities that we are all working to get accomplished. So in June 14th, I'm sorry, of 2018, the National Breast Cancer Coalition proposed to this bill, which is the Metastatic Breast Cancer Access to Care Act. And the idea is that this bill would waive what personally I think of as arbitrary waiting periods for Medicare and for Social Security disability insurance for people who've been diagnosed with metastatic breast cancer. Anne is obviously going to get into a little more detail about why that's so important. But what we've been doing since 2018 is literally reaching out to congressional members for the state of Virginia, asking them if they would be willing to be co-sponsors to this bill. It has not yet made its way to the floor. That's what we are working to get. Kirsten will speak a little bit later about the number of Virginians who've actually signed on and the total number of congressional members who signed on totally. So the idea is for us to reach out to them. Frankly, we do it several times a year, about 3 or 4 times a year specifically. And then at the closing of the summit the National Breast Cancer Coalition Summit that's coming up at the end of this month, we usually have the annual lobby day. I will be there again this year. We will not actually be going on the Hill, I don't think, because of security restrictions that have been in place for the last 2 years, or at least the last year. But we will have our virtual meetings as we've done for the last 2 years. And quite frankly, I think that the virtual meetings have been very successful for 2 reasons. One, I think it's easier for the legislative staff members to go from meeting to meeting just by logging onto their computer. And it's additionally easy for the advocates in the state of Virginia who've been willing to join us in those meetings to be able to sit at home at their computer as well. Now, I personally enjoy the physical in person. There's just something about walking those halls and knowing what our purpose is and getting an opportunity to pop in and actually see where, maybe not so much where the laws are being made, but at least the staff folks who are actually doing it. It's quite exhilarating, frankly. So we won't actually be doing that physically this year, although I may actually be doing some meetings if we determine that there is any way for us to physically get on to Capitol Hill to be able to do that. The goal for us this year is to get more of our Virginians.
I think you froze a little there. Oh, there you are.
Hello?
You froze for a minute there. So maybe just repeat the last sentence that you said.
Okay. So it doesn't really make a lot of sense when you think about it. If a person who is diagnosed with metastatic breast cancer and qualifies to be eligible for Social Security disability insurance, and then subsequently cannot get access to those benefits because there is this waiting period. The same is true relative to Medicare. If someone is diagnosed with metastatic breast cancer and they are younger than 65, they have not yet qualified for Medicare, but they're eligible because of their disease. So this bill would waive those waiting periods, 24 months in one case and 6 months in the other, so that they would be eligible for those benefits as soon as their doctor deems them eligible from the disease perspective. There is precedence for this, for the bill that we have put on that we proposed, because this was done for ALS. ALS had those very same waiting periods, had the very same timeframes that people had to wait. And I believe it was 2001, they passed the ALS bill to make sure.
Marilyn, let me flip. I'm going to flip to the next slide because that might,
Okay.
I have some other information that I thought maybe before we get to the ALS part, let's maybe go back and I'd love Anne to talk a little bit about, again, what you said, why we need this.
Sure.
Sure. So Kirsten's got some great information here, and I won't read it verbatim, but just to hit a couple of highlights. Metastatic breast cancer, for those who don't know, is when the cancer has spread beyond the breast, typically to the bones and the lungs, the liver are the most normal ones, sometimes to the brain, and it's incurable. So at the point of diagnosis of metastatic breast cancer, you're treating for, no longer treating for curative, you're treating to prolong life as long as we can. And we tend to try and string treatments together to get as much time as we can. And that's where this act and the numbers are interesting. I remember saying to Marilyn at one point, the math just doesn't add up, because the median life expectancy of someone with MBC is still at 3 years. That has not changed. Even though there are more treatments available now, those median statistics are still 3 years. So you become eligible for a benefit, but have to wait 2 years to take advantage of it. And you potentially will pass in that time or not have much time after that. And what's interesting to me in the stories I've heard from people is the number of people with private insurance I'm fortunate to be on my husband's plan, is not a huge percentage of the country. And so a lot of people do depend on the Medicare benefit, but having to make that choice of, do I continue to work? Do I not continue to work? And what fills that 2-year gap in healthcare between the point you make those decisions? And so those waiting periods can be really, really negative, have a negative impact on people who aren't able to make the choices that they need to make for what's best for their health, what's best for their family, while they try and figure out how to get healthcare. So that access is so important. And one thing that I think is interesting about SSDI is that this disease is listed on the compassionate allowance. It's accepted that it's a terminal disease. And so it is on the compassionate allowance list for SSDI. So it just doesn't make a lot of sense that you have to then wait to get those benefits that you've already qualified for, which is what I think is the oddity there. And as you're going to hear, there is precedence for that. But to me, it's about the math. If the median life expectancy is 3 years and this is your access to healthcare, you need it as soon as you're eligible for it, not 2 years into your disease. Yeah. So Krista, I don't know if there's anything else you wanted me to cover.
No, I think that's great. And as Ann and Marilyn both alluded to, what are some of the questions or challenges that you might get when talking about this bill with a legislator? I don't know, Marilyn, you may want to, this is where maybe we can talk a little bit about that federal precedent, because I think it does make a difference for legislators to know that we're not necessarily asking for something out of the norm and that sort of thing.
Yeah, so one of the pushbacks that we get has to do with why should they do this for this particular disease? Why not do it for other diseases that are terminal as well? And that's a valid question. We certainly support what's being done with other diseases, but we are breast cancer advocates. So we'd like to make sure that breast cancer patients who are diagnosed with metastatic breast cancer are taken care of as soon as possible, rather than wait who knows how long, for all of the other terminal diseases to be taken into consideration. In 2001, Congress passed a bill to add ALS as a qualifying condition for automatic Medicare coverage. And in 2020, they waived the 5-month waiting period for SSDI for individuals with ALS. So they've already done this with ALS. They've recognized that it makes sense. Some of the same people that we are reaching out to have supported the ALS bill. So we're working as hard as we can to get them to do the same thing for the Metastatic Breast Cancer Access to Care Act. We believe that both Medicare as well as the SSDI waiting periods should be waived. One of the other pushbacks we get has to do with the cost. What is it going to cost us, relatively speaking? One of the disadvantages of getting some of the information we need about how many people are living with metastatic breast cancer has to do with it's very difficult to get those numbers. It's really difficult. But what we do know is that it's a small number, relatively speaking, enough that it would not have a significant impact on the cost of care. These people are already eligible for it, so they would be getting those benefits anyway. The CBO, the Congressional Budget Office, has not yet scored it, but a report did come out, I believe it was last month, that said that they were actually going to be looking at it. There is nothing yet that says exactly what should or shouldn't be done from the CBO office.
Great. Well, before we move on to sort of where the bill is at this point in Congress, I wanted to just open it up for if anyone had any questions about what we've covered or about the bill. Okay. If not, I will move on to, so as Marilyn mentioned, we are excited that the bill has bipartisan support right now. It's not a bill that only has Democrats signed on or only Republicans signed on. and that's very positive. As of yesterday, when I checked, we have 180 House co-sponsors, and in the Senate, 26. And the general idea is that to get this bill to the floor for a vote, we would need a majority of House members, majority of Senate members. So that would be 218 in the House, 51 in the Senate. You know, the idea, as Marilyn said, is to show that this is a bill that all sides of the aisle care about, and that it does have that, you know, broad support. And so, you know, that it can't be a, you know, don't want it to be a reason that someone might not sign on if they look at it and say, well, no one from my party has signed on. Great news that in Virginia, we have 5 of our representatives of our 11 of our coalition already signed on. And just a little background, we are in the 117th Congress. This bill was introduced first in the 116th Congress. We're now, the 2021 to 2022 is the 117th Congress. So it was reintroduced last year. And as Marilyn said, we had meetings with some of these legislators last year as part of Lobby Day. And as a result, they've signed on to the bill, which is fantastic. But here's where we are now. These are, and I'll reduce my screen here. These are our target list for legislators that we hope will sign on this year. And you'll see my little notations here. The hashtag next to someone's name means that they were a co-sponsor of that ALS bill that was passed recently. So again, they might be, that's Representative Klein, Representative Wexton, and Representative Whitman. You know, that they may be key folks that, you know, we can make that argument of, well, you did this for ALS, we would like the same thing for metastatic breast cancer. You know, what's the holdup sort of idea. And then you'll also see on this list, Representative McEachin. He actually was a sponsor of the bill in the 116th Congress. So we're hopeful that he would sign on again this year. And then Representative Good is a new legislator as of the 117th Congress. So again, another person that, you know, we feel like is a good target that we could talk to about the benefits of this bill as we go into Lobby Day. And, you know, just as a general idea, as I said, the 117th Congress will end at the end of this year. So there is a little bit of a time crunch of, you know, the time is now to sort of get this bill moving in Congress, because if it doesn't get to the floor or have a vote, it will languish, it'll die at the end of the calendar year, and we'll have to reintroduce it next year, which we certainly will, but it would be wonderful if we didn't have to keep doing this. And, you know, the reality is there are many bills you do have to reintroduce many years over and over again. And, but we sort of feel like this, it's kind of a no-brainer, and it really should have no big, you know, opposition. So with that said, you know, one of our main tools for, you know, getting to talk with legislators and convince them of the benefits of this bill is our Lobby Day coming up on May 3rd, and it's a Tuesday. I'll cover a little bit, and then Marilyn or anyone else, please chime in. You know, basically, as I said before, in years past, we've gone up to the Hill. We're not doing that this year because of COVID and all the restrictions, but we will be, I'm in the process of trying to get meetings right now, Zoom meetings with our legislators, and particularly those targets. You'll see here in this picture, we did meet with Jennifer Wexton, Representative Wexton, in 2020. And, you know, so again, sometimes you just have to keep going back and reminding them that we're still here and that we really want their support for the bill. And, you know, in a general way to give an idea for folks who might be new to doing this kind of these meetings, the great thing about National Lobby Day is that the National Breast Cancer Coalition has trained team leaders, and both Marilyn Miner and Jessica Ramirez are team leaders for Virginia, and they have additional training about the bill, they're there to sort of help lead the meetings and maybe answer any of the tough questions that a legislator might throw at us or their staff member. But it's really wonderful when we have Virginia advocates who are constituents who have a lived experience with breast cancer to really share their stories and talk to the legislators about real people and how this impacts real people in their district. So, I'm often looking for, advocates who might be a constituent of one of the members that we're meeting with. So sort of back to this slide, if one of these folks is your legislator, please let me know, and please reach out to them and say, I'm in your district and I want you to support this bill. So the main things that we'll talk about, maybe I'll let you talk about that, Marilyn, of the sort of things that in the meeting we'll cover.
Yeah, so when we do the meetings, let me just back up to my first time was in 2017 going up to Lobby Day. But in 2018 when we went, and I don't know much about this bill, I did sit through the training for it, but I did not feel well versed to really talk about it. And I didn't have to. That was the role of the team leader. And we're split up by into teams of people when we're physically there. And it's very similar, as you can see on this photograph. We had a number of folks, both Jessica and I were on the call, and we took turns where with one legislator, Jessica led the call, the next legislator, I led the call. And so it's our role to take them through, here's who we are, here's why we're here to speak with you, and here's what we're asking you to do to support. And actually before that, we have everybody who's on, so all of these people in the little grid introduce themselves, and I'm Marilyn Miner. I'm a 7-year breast cancer survivor, and I am in the Richmond, Virginia area. Boom. Each person kind of explains who they are. So if you are a constituent, their eyes perk up, right? If you say, and you are my congresswoman, or you are my congressman, like that. Just like anything else, they want that acknowledgement that you matter to them, for lack of a better word. So we're really looking forward to having more participation. Sheer numbers are really going to make the difference with this. I mean, Jessica, Kirsta, Anne, and a few of us who've been doing it, and Katie for a few years can continue to do it. But it's only going to make a difference when we can show that grid has people off the charts. We have multiple pages of people if we have to do it virtually, so that they know that it matters to Virginians. It's not just something that a national organization is trying to accomplish. We make the ask. They usually have a few words to say, and sometimes questions. If there are questions, Jessica and I field those questions, and then we kind of go from there. That's kind of the end of the call itself, both in person as well as virtually. That's as much as you need to do. It's more looking for the numbers to represent that Virginians want this bill to get to the floor, to get passed.
And I just wanted to add to that, though, Marilyn covered it beautifully, but really a lot of times what makes the biggest impact is sharing your personal story. I mean, me talking about this, or like Marilyn said, her kind of going over the priorities and things, obviously that's important, but sharing the personal story is really what has the biggest impact with the legislators or the legislative staff.
Definitely. I'll just mention, because it's on this slide, but we don't need to go into a lot of detail. For this year, in addition to the Metastatic Breast Cancer Access to Care Act, we'll also be asking our legislators to support the Department of Defense Breast Cancer Research Program. That is a very innovative research program that's housed in the Department of Defense that we are very supportive of. What's unique about it is that the researchers, their proposals for funding are reviewed by actual people with breast cancer and experience with it, so that the idea is that these kinds of research projects are really going to impact actual real people versus some esoteric idea of research. Marilyn has been one of the peer reviewers for these these research projects. And I had the number here somewhere. I'm going to try to find it real quick. I can't find it. The Virginia Institutes, I think it's $3.8 million have come to Virginia through this program. Don't quote me on that. I can send a follow-up. But anyways, that's another key priority. So those would be two of the main things that we would be talking about. And then I wanted to mention, and Marilyn, you can help with this too, or anyone else, in this new, environment of not necessarily being in person and folks participating virtually, we also this year want to try to push sort of a social media blitz on our lobby day and maybe leading up to it, where, and this is sort of in the works to show up, I'm working on this now, sort of a page where you can go on our website and get all the information you would need to tag your legislator on Facebook or Twitter and try to just get messages out to them that, we want you to support this bill. This is really important to us. We are sort of creating some graphics that you could attach to sort of grab people's attention. And so that's to be determined, that's in the works, but I will certainly send out to everyone sort of where we are with that very soon. But it's just the idea that if for some reason you couldn't, we hope you'll be able to participate in the lobby day meetings, but if you can't, this is another great way to sort of make your voice heard, especially if you have a legislator on our target list. Again, hearing from their constituents and your personal interest in this is wonderful. VBCF will do a lot of this as well, but again, as an organization, it has some impact, but I think personally, and as Jessica said, personal stories really grab legislators' attention. So this is just to say this is sort of in the works.
I will say,
yeah, go ahead.
If I could, Kirsta, as it relates to social media, I have Facebook, I have an Instagram account. I don't really do much with it, but I do a fair amount with Twitter and with Facebook relative to my breast cancer advocacy work. And it's really easy to do when VBCF, and VBCF has been, Kirsta and Lisa are really great at providing us with, if we've got the artifacts, all you need to do is to create a message, copy it, and send it. And tag your representative, and send a list around as well of what the representatives' taglines are for Twitter, because they all have a Twitter account, they all have Facebook, and it makes it really easy. It's also easy to just share what VBCF posts on Facebook, and you can tag them there as well. So it should be pretty easy for us to do that, and I think the challenge is to get more of our own personal friends and family, if you will, to do them. Maybe, kind of challenge ourselves to get more people involved this term.
Yes, and I think just piggybacking on that, Marilyn, we have heard from, experts in media, including Ann Woodward, expert, that Twitter is a really important tool, especially for staffers on the Hill. They get a lot of their news from Twitter, and that is something that we're gonna, VBCF is gonna use our Twitter account more robustly this season and try to really, again, get the message out as clearly as we can and really try to push it. But
I will also say when you use Twitter, for example, NBCC has a Twitter account, very, very active on Twitter, because it's focused on Capitol Hill a great deal and public policy and priorities. And when someone else, for example, NBCC will post that a congressperson from a different state has signed on to support the Metastatic Breast Cancer Access to Care Act, I will then quote tweet. I will add a little blurb. Thank you, so-and-so, Representative blah, 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 and it's so simple to do because his title is right there, or her title or tag is right there. Do you know that there are doctors, researchers who see that and who will also retweet what I've tweeted? So people are paying attention. Those tweets do get a lot of impressions. The same thing is true with LinkedIn, I'm discovering, by the way. LinkedIn is getting a fair amount of that kind of activity as well.
That's great. Well, at this point, I'm going to stop sharing my screen so we can sort of all be together again and chat if we want to. Again, if anyone had anything specific that they heard in the presentation they want a little more information about, please let me know. You know, again, we're sort of in the process of making meetings for Lobby Day. And I will be sending those out through our advocacy alert system, but also on our Facebook. I'll sort of be advertising Lobby Day, that we would love more advocates to be part of our group. You know, I will mention that the Lobby Day meetings are usually pretty short, 15, 20 minutes. And if you can't make all of them that day, great, you know, sit in on a few. We're happy to have any and everyone part of that. So, you know, stay tuned for more information about that. And we'll certainly keep you up to date if we get some other co-sponsor sign-ons in the meantime before Lobby Day, you know, and just sort of keep plugging away on this. But yeah, just wanted to open the floor if there were any specific questions or comments. Great. Well, good.
I'm sorry, Krista. Any additional information, Kristen or Sherry, that we can share with you?
So I guess a question that I have is, so for these 15, 20-minute sessions with the congressmen and women, so is there a set agenda that you do, or a tailored agenda maybe for each meeting?
That's a great question, Kristen. I'm sorry, I should have covered that. What we like to do is have a little pre-meeting with all of our advocates before Lobby Day. I don't know when that will be exactly, where we'll just go over a quick sort of logistics. How's this going to go? Last year on the Zoom, we sort of did a, you know, round robin, introduce yourself and where you're from in Virginia, little blurb. Marilyn and Jessica would take turns, you know, giving the basics of the bill, and then we would sort of open the floor for comments, story sharing, questions from the staffer or the member. So that's kind of the general idea, but we definitely like to meet as a group before we head into that day, just so that everybody knows and is on the same page. Yeah, I should.
Yeah, totally agree.
Yeah, yeah.
And just to throw out there, Donald McEachin is my congressman.
Oh, woohoo! Okay,
Perfect.
You can say that.
That is perfect. Donald McEachin attends my church.
Oh,
and
cool.
because we haven't been in physical church for 2 years, I haven't been able to grab him by the throat. No, I haven't been able to get to him, and he has signed on in the past, and he's very supportive, but for some reason has not signed on. I did notice, Kirsta, in the list of contacts that came over from NBCC this morning, it didn't appear that Justin is his LA anymore. Did you notice that? Yeah, so he had a guy who I would text him. I literally had I just had what I thought was a really good rapport. He's no longer his LA, and I don't know if that has a little bit to do with maybe things falling through the cracks, but you can believe that I will be on top of this new person. And we are having a sunrise service on Sunday. I don't know if he's going to be there, but I will be there. And I hope to see him, though, really. I mean, he's a good guy, and he's been very supportive of what we're trying to do. It's just, you know, it's taking time. And one last thing, and we've said it before, but I'll say it again, and that is, this bill is bipartisan. There is no, you know, no leaning one way or the other. Breast cancer doesn't discriminate. You know, metastatic breast cancer doesn't discriminate. So we're really looking to get support across the board. Mm-hmm. And I would love it to find, you know, some other folks to support dealing with Whitman, because his office is not even budging.
It does often happen that the staff changes a lot quickly on the Hill. And so who you thought you knew. And I agree with Marilyn, maybe it's that the new person, hasn't seen it come across their desk, even though I feel like we email like every few months, we're emailing about this bill.
Right.
So we just need to do it a little more. And I think it's just a great time with National Lobby Day to sort of focus in and say, we have a group of advocates coming. Do you want to really be the guy that says no to a whole screen of people?
Well, and then had it not been for the security concerns, I would have been in DC. I was there in October for a meeting, a board meeting, as well as another training. And I would have been there in January for a board meeting. And whenever physically be in DC, I normally would just hop on over to Capitol Hill. It's not a big deal. In probably an hour and a half to 2 hours, I can literally hit everybody's office, dropping off some information. That face-to-face, believe it or not, does make a difference. They ask you to sign in when you come in, so they want to know who's come in from their districts. And I sign whether I'm in their district or not. I'm in Virginia, and we're there to represent people in their district. So not being able to do that, I think, has been a bit of a detriment for us doing this kind of advocacy work.
Or
And I just wanted to note that during this call, I now follow you on Facebook and
Great.
Instagram.
wonderful.
Don't really do much with Twitter, but I can try to get on there. And then push this out to friends and family and see if we can get more people to jump on Tuesday, May 3rd.
Thank you.
Tuesday, May 3rd, I do have an infusion scheduled for that day. So we'll see how many that I can jump on, but
That's fantastic.
very, very exciting. Like, thanks for bringing me in.
Yeah, I'm so glad that you were here, and
Me too.
I will follow up with some of the more of the specific details, but you will see it on Facebook and stuff. But please reach out to me if you find that you have other questions or something pops up, because I feel like I talk about this a lot and I think I've covered everything. And then sometimes, as you said, like, is there an agenda for the meeting? I completely forgot to say, we have a meeting pre-meeting so that we're all on the same page.
But I would say too, Kirsten does a really great job, and she does kind of give us a template too. So even if you can get on one meeting, you can't get on the next, the agenda template. So it's easy to kind of fill in or not. So she makes it very easy for all of us.
Great.
That's good to hear. Great. Well, I will, let's wrap up, but I think, again, keep in touch and you'll see more information coming out from us as we sort of lead into the next couple weeks. It'll be fast and furious trying to get appointments and things. And if you aren't already signed up for our advocacy alert emails, and Chris and I can send you a link for that. That's the quickest way. That's sort of a core group of people that are involved with VBCF that care about advocacy in particular. So I try to get that out first, then I post it on Facebook, then it goes in other things. So that's the quickest way. And yeah, and I'm always here to answer questions or shoot me an email. So great. Well, thank you all for being here today, and we hope to see you on Lobby Day.
Thank you all.
Thanks.
Bye-bye.
Thanks, everyone.
Thanks,
Bye.
Kirsten. Great job.
Thank you. Bye.